As pet parents, we want to keep our fur babies happy and healthy, as well as give them what they want and need. Unfortunately, that whole language barrier thing can sometimes make it tricky to figure out exactly what that is. Generally, there are 3 primary ways that you can tell when a dog needs your help: physiological changes, behavioral changes, and signs of pain or discomfort. If you have a dog, then you know how unbelievably tricky it can be to tell if or when it's in pain. In this video, we are telling about 12 signs how to tell if your dog is in pain. Let's get started. Number 12, your dog is breathing heavily. It is normal for dogs to pant heavily during and after exertion. But panting after exercise can sometimes also indicate medical emergencies, including pain, heat stroke, or poisoning. It's also one of the dog illness symptoms to watch out for. Panting is a subtle, often overlooked sign of pain. Some dogs in pain pant more than usual, but eat, drink, and seem normal. If the temperature where the dog spends most of their time hasn't changed much, but the amount they're panting has, heed this warning and consult your veterinarian right away. Panting can also be a subtle sign of severe pancreatitis. It was in my own dog, and even I, as a vet, these symptoms can mean that your dog has cancer. Number 11, monitor how your dog eats. Dogs in pain may reduce their food consumption. If your dog has a decreased appetite, it may be a sign of illness or pain. In this case, it's crucial to take your dog to the vet immediately to rule out a serious problem. Dogs with mouth pain may drop food when they eat. If your vet says that there's nothing wrong with your dog, then it's probably best to replace their food. Because of the high amount of fat in dog food, it may sometimes spoil, which could be why your dog refuses to eat it. Number 10, it can't stop licking. If your dog is licking itself constantly or gnawing on a body part, it may have pain on or under the skin. According to Dr., a board-certified veterinary behaviorist with the veterinary medicine. This obsessive behavior could also be a sign of anxiety, itchiness, a compulsive issue, or gastrointestinal pain or discomfort. The main issue with excessive licking is that although it may temporarily calm pain receptors, the licking itself may injure the skin and exacerbate the pain. Researcher likened it to when people scratch a wound. Often the licking is intense in nature and directed at one particular area, presumably the source of the discomfort, vet said. Number 9, hair loss/itchy skin. Hair loss, also known as alopecia, or persistent itching, can be caused by skin infections, fleas, or allergies. This can cause extreme discomfort. Examine your dog's skin for fleas, signs of flea dirt, which looks like fresh ground pepper, redness, swelling, pain, or an abnormal odor. Mild symptoms can be soothed with a bath, but more severe signs should be evaluated by a veterinarian. Number 8, aggressive behavior towards other dogs. If your dog is usually very friendly with other dogs, then suddenly appears to become reactive, this could suggest that your dog is in pain. Many dogs will react by barking or growling around other dogs if they are trying to protect themselves. If your dog has a sudden temperament change, it is always a good idea to have him or her evaluated by your veterinarian. Number 7, increased vocalization. Dogs often communicate that they are in pain by making more noise. This is the closest thing they have to speaking. Vocalizing can be in the form of whimpering, yelping, groaning, grunting, whining, and howling. It is often hard to know why they are in pain, but if they cry when a certain area of their body is touched, then it is most likely to be the sore spot. Number 6, walking more slowly or stiffer than usual. Pain in the joints, muscles, or spine may cause your pup to alter their gait to minimize the discomfort. They may keep their joints stiff and unmoving to avoid pain from rubbing joints. Walking can also be affected by an infection or injury. Pain in the joints can be relieved by anti-inflammatory and muscle relaxant drugs, surgery, splints, rest, and ice. Injectable steroids are available to lessen pain by decreasing inflammation directly in the joint. Number 5, changes in personality. When dogs are in pain or don't feel well, they tend to display behavioral changes, such as decreased activity or lethargy. Some sick dogs that are normally social may start to withdraw. A kind and energetic pet may begin to show snippiness or aggression. Notice if your dog growls when you get close to a particular area of the body that may be the source of discomfort. Not all sick dogs will display negative behavior when they are ill. Some dogs may become clingy or show signs of increased neediness. Some just display changes in their routine, which is typical for dogs with canine cognitive dysfunction. Monitor your dog for additional symptoms, such as lack of appetite, abdominal pain, vomiting, diarrhea, lameness, or straining to urinate. If you notice significant alterations in your dog's behavior or additional symptoms, contact a licensed veterinarian. Number 4, pay attention to the potty habits of your dog. If you're aware of the normal bathroom habits of your dog, it'll be much easier for you to recognize if there's a problem. If your dog is in pain, you might notice that it exhibits a new posture when it defecates or urinates. For instance, a male dog that lifts his leg to urinate suddenly might not be able to. You might also see some changes in how frequently your dog does its business. Aside from that, pain may change the consistency of the stool of your dog because of related stress. It may also result in constipation sometimes. Number 3, look for changes in your dog's sleep habits. Dogs in pain may feel restless or exhibit an inability to lie still and get comfortable. Pacing or repeatedly getting up and down are often a sign of pain. When a dog is in pain, their sleep patterns may also be affected. They might sleep more than they usually do, or they may experience difficulty sleeping. It all depends on your dog's typical behavior and routine, so remember to take note of your dog's typical behaviors. Number 2, biting or growling. If you were in pain and someone wanted to pick you up or touch you where it hurt, you might want to bite their head off, or at least tell them to back off. As distressing as it might be to have your fur baby growl at you or worse, your dog feels exactly the same way. If you touch a dog and he yelps or attempts to bite you, that would indicate extreme pain, such as we might expect to see in a dog with pancreatitis. For example, says doctor, even a gentle, friendly dog may bite their best friend if they are hurting. If your usually gentle pal has become aggressive, growls when you approach or touch her, or gets nippy, a vet's appointment is a good idea. When your dog is giving you mixed signals, use these signs to tell if your dog is happy. Number 1, eye changes. Red eyes, runny eyes, squinting, or holding the eye closed can be signs of problems that range from a mild infection to an ulceration or glaucoma. If your dog is pawing or rubbing at the eyes, try to stop this behavior and call your vet. Rubbing at the eye can cause serious damage. An e-collar may be required in addition to medication administration, as prescribed by your vet,